Welcome back to Heartland Afternoon. Let's talk health with students. Back in the classroom, parents, you may want to pay attention here. You know, it's only a matter of time until one of your little ones brings home a cold or a stomach bug. More concerning though, a new case of whooping cough in the Show Me State. The story comes from an early childhood center in Republic, Missouri. That's just west of Springfield. Officials say a child there has a confirmed case of whooping cough. Pediatric doctors say while it can be deadly, it's also treatable with antibiotics and preventable with vaccines. Now, it's not likely your child will bring home something like whooping cough this school year, but we also want to be our healthiest and safest selves on Heartland Afternoon. That's why we have Amber with the Cape County Public Health Center joining me live today. How are you?
Good, yourself?
I'm doing grand. I appreciate you taking the time to be here. So whenever we start with this topic, what are some of the most common illnesses this time of year?
So this time of year, we see whenever the kids are getting back to school, we see some respiratory stuff. Usually it's more closer towards October, November, but also stomach bugs, like the dreaded stomach bug that parents do not want because when one kiddo gets it, like you said, it spreads through the whole household and everybody is just, it's not a fun one to have.
Yeah.
So, and sanitizing everything is so important. Making sure kids know how to wash their hands, like your little bitty preschoolers, all the way up to making sure even your high school students, they know how to properly wash their hands is such an important step in taking the first initiative.
Yeah, and something we were talking about earlier in the break, we were talking about how, you know, it's not just a one and done teaching thing. You kind of have to reinforce it, correct?
Consistently, yes. Making sure that they know not to just go in there and wash their hands with water real quick and leave. You want to actually take the time to teach those kids, make sure that they know to sing the happy birthday song, say their ABCs twice, kind of get that good soap, water, consistent, using warm water, and then drying your hands off after.
And whenever we talk about how easy some of this stuff spreads, I mean, to any parent, they know this firsthand, but how easy can it be? What does that look like?
I mean, it could just be one kid who sits in a classroom and sneezes and does not cover their mouth when they sneeze, and then you have those potential for those kids sitting around them who caught that sneeze to possibly get sick and then spread it to their friends in, you know, another classroom or that same classroom until all the kids in the classroom have it.
And you know, it's also a part of manners as well. So for the parents that have kids watching right now, maybe they're home today, make sure you sneeze into the elbow.
Elbow, yes. Or if you using a tissue, after you use a tissue, make sure you're washing your hands again. Or if you need to step away, if you're in a group, step away and sneeze over in another spot that maybe less people are there, or hopefully nobody. If you can find a spot in school, is probably a better option.
So what can parents go over with their younger kids? I know we just mentioned part of it. Anything extra?
You know, making sure kids get enough sleep, and then good nutritious food too helps that body keep that immune system up, and it benefits those parents in the long run too with being able to keep their kids healthy and in school.
Yeah, and I can't remember, you know, granted you don't actually know some of the kids' lives who you go to school with, so you kind of have to give a little bit of grace here.
Oh, yes.
But I can remember in school, I'd feel, it'd be like, is it raining? I'd hear someone sneeze and I'm like, where did that come from? So just the importance of course, making sure you sneeze into your elbow, of course. Also, is it good to send the kids with the Germ-X?
That's a good option too. Germ-X is a great option if you don't have access to a sink. It's great for, you know, maybe kids, especially high school kids who are going in between class to class, maybe don't have enough time to go to a bathroom and actually physically wash their hands. That's a good option until they can get to an actual bathroom to be able to wash their hands with soap and water.
Of course, and oftentimes we hear about the struggle with parents and their kids whenever it comes to, okay, they say they're not feeling good, should I actually let them stay home? What's the proper protocol there? Well,
a lot of schools, they have their policies in place. Usually if there's a fever, it's a certain amount of what that fever is, usually 101 or greater, but you'd have to check with school to see what their policy is, making sure that they're not using any kind of Tylenol and then sending their kid to school because that can mask a fever.
Really?
So it can mask a fever. If a kid's getting a fever coming on and they're like 99, they give them some Tylenol and send them to school, there's a chance later on they may be getting a call from the school nurse saying, your kid's running 101 because that Tylenol wore off and then that fever came back. So that's something to be cautious about and think too.
Well, Amber, we appreciate you taking the time to be here so much and sharing all of your knowledge with us here on Heartland Afternoon.
Thank you.
All right,
I appreciate it.
Yeah. All right.